Hi everybody, we're here today to talk to everyone about pelvic floor health and pelvic floor laxity and or incontinence or urge incontinence or sneeze and squeeze or there's lots of different ways to approach this subject, and it's important and it's common.
Yeah. So let's talk about it. So incontinence, and really what does that mean? So it's a very common problem, way more common than anyone would ever imagine. Often it happens in women, but men are in there too as we get older, particularly in women that have had kids with natural childbirth. Those muscles of the pelvic floor, they weaken over time. So they get stretched out, they get weakened. Sometimes they can tear during childbirth. And really all that means is our bladders are not as supported as they used to.
Mm-hmm.
So think about that pelvic floor almost like a hammock. So those muscle fibers are at the bottom of our pelvis. It's sort of at the bottom of our torso, and our bladders sit right on top. And as those fibers weaken over time, the bladder doesn't have as much support. And what does that mean? It means that you really just can't hold your urine the way you should be able to.
Mm-hmm. And there's a little bit of behavioral aspects of it as well, which is the bladder is actually a muscle itself. And then there can be sort of that, I can't wait, I'm going to empty. And then I can't wait, so I'm going to empty. So if you don't let your bladder fill the whole way, then it doesn't stretch. Like a muscle, it needs to stretch so it can contract. And when we're worried about losing our urine at the wrong spot or having to go urgently at the wrong time, we often empty prematurely as females. And so that behavior does need to be kind of addressed, and we need to pay attention to that as well. And so all of these muscles work in conjunction. Yep, together.
Yeah. So, I mean, it's a huge issue, which really affects people's lifestyle and really their ability at the end of the day to enjoy their life and have a healthy life.
Mm-hmm. Where's the bathroom? Where's the bathroom?
Yeah.
Where's the bathroom?
And you know, I wouldn't say that we're overstating it. I mean, there's plenty of people, again, men too, but mostly women that are waking up in the middle of the night to go use the bathroom. So now our sleep is getting interrupted. And we all know enough about the science behind sleep, how important that is in the regeneration of our body, in our mind, in your feeling of wellness when you wake up in the morning. So if you're waking up 1, 2, 3 times in the middle of the night to go to the bathroom, you're just not going to be your best the next day when you wake up. And when this happens day over day and week over week, you're going to age, right? Your body is going to prematurely age at a much faster rate because you're not getting the sleep that you need.
Well, then there's the other portion where maybe you're 45, 55, 50, pushing 60, and you're like, oh, I'm going to hit my new gym class. It's a new year. I'm going to tackle those jumping jacks. And then you get into the gym and you start jumping jacks, and you're like, what's happening down there? I'm literally leaking with every jump that never happened before. When did that happen?
Yeah. Or, you know, you
That's
get to the
pelvic floor.
It's the pelvic floor. Or somebody tells a really, really good joke and you're laughing. And all of a sudden you're like,
squeeze.
Oh my God. Yeah. And you leak. And you know, if you're having this issue and you're feeling embarrassed, don't. I mean, it's such a common problem. You go to the drugstore and I think there's now like an entire aisle, which is just dedicated to this, right? So protective padding so that we don't leak through our clothing. So the issue is significant. Okay.
So then you go to your doctor and your doctor says, well, 20 years ago, do some Kegels, do your Kegels. And so you can sit there and do 10 or 20.
And so what is a Kegel?
Oh, the Kegel, it's like a squeezing of the pelvic floor muscles. Some people can't feel them. Yeah. It's like yoga. You have to do yoga for X numbers of weeks before you can actually find those muscles to do the proper yoga.
Yeah. So it's an exercise, right, to improve the strength of your pelvic floor. You know, much like doing a bicep curl, right? To strengthen your bicep, you do like this tightening, so around your pelvic floor. But as we know, it can actually be really, first of all, very difficult to do, especially if those muscle fibers have been damaged over time by surgery or childbirth. So a lot of people just can't even really feel it to do it properly.
Yeah.
So that's one issue. And then the second issue is really to make headway with that and to really get that muscle strengthened over time. You have to do many of them and you got to do it every day.
Yeah.
And I don't know about you, but whenever I try to do it, I'm like, oh, right, got to do the Kegels. And then I start, and then
10.
30 seconds later, you're getting distracted with
Yeah.
something else that happens. So, very quickly, you kind of forget all about the Kegels. And next thing you know, 3 months have passed and you haven't done a single one.
And the pelvic floor is part of your core. It's part of a postural muscle. So it actually needs to have a different kind of a workout, and it needs to have tone, and it needs to be able to hold tone. And then we need our obliques. And the last part of the core is the pelvic floor.
Right. That's the bottom part.
So if you've ever been in a Pilates class, you know how to engage that pelvic muscle and how important it is in that class. So that's how to find it. But how do we exercise it on the side?
Yeah. So we are firm believers of the Emsella Chair. So that's the brand name. Emsella is actually, it's an amazing device. It's a chair and you just sit on this machine, and inside the drum of the chair, so like down below, it's like think about it like a very strong spinning magnet. And as that magnet spins, it creates an electrical stimulus that then contracts your pelvic floor. So you literally sit on this thing with your clothes on, and as you're sitting on it, this magnet is stimulating your pelvic floor to contract. And the cool thing about it is, I think within a matter of 30 minutes, you're doing 50,000 Kegels. Which is pretty amazing.
Yeah.
It doesn't hurt. I mean, you can feel it. So it's like you're sitting on this thing and you can feel your muscles sort of contract and relax. So, the first time you sit on, you're like, well, that's weird, because I'm certainly not used to that feeling. But it really is just a muscle contraction and not painful in any way.
No, not painful. I like to describe it to patients as bringing up the bicep curl again, which is, it's full extension, and you got your weights that are light, medium, or heavy. But if you've ever been to a class and then the instructor says, pull the bicep up and get some tone in it, and then flutter your weight. So the machine operates kind of like that. It puts the tone and the contraction into the muscle, and then it fires the contraction really, really super rapidly to work that muscle for you.
Yeah. So basically it's think about it like a boot camp for your pelvic floor. And it really does work. Actually, it's pretty phenomenal. So a typical session for most people, usually it's just 6 treatments. So you're coming in 6 times. So some people will come in twice a week. So they're kind of done within 3 weeks. For some people, they can only manage 1 day a week, which is fine too. And then it takes 6 weeks. Through the strengthening that happens to the muscle is so fast that for the vast majority of people, once they're done their 6 sessions, they all of a sudden have way better control of their bladders. So sleeping through the night, coughing, sneezing, laughing, not leaking anymore, being able to go through longer stretches of the day without having to continually, find the bathroom and running to the bathroom all the time.
That urge incontinency, yes.
Yep. Yeah. It's really very effective. And then just like any muscle, it does require some maintenance to maintain the strength. So again, the typical course for most people, so you do the 6 treatments, like a boot camp, you get that muscle all nice and toned and tight. And then for most people, then they just do 1 session every 3 months just to maintain that strength that has been built.
So that's all embedded into sort of our program at the clinic. So we did realize that we do want to provide maintenance for people as they need throughout the year.
Exactly. And our way of doing it, which is not the same everywhere, but for us, we do realize that there are people with different needs. So sometimes if it's more significant issue, some people will need more than the 6 treatments up front. So in our case, we always welcome people to do really as many treatments as they need to until they get the control. So the strength that you need in that muscle to really control the bladder. And we find once you've built the appropriate strength, then the maintenance is actually very easy. So again, just once every 3 months to maintain that muscle strength.
Occasionally, again, like a muscle, when you first start using it, it actually gets a little fatigued and a little exhausted. And then when your muscles are a little exhausted and fatigued and sore, they're actually hard to use. So at the very, very beginning, occasionally people feel like, oh, I'm not getting better. I might be a little worse. But then as that muscle builds the tone, it gets ramped up.
Yeah. It's pretty cool.
That's not very often, though.
I kind of wish there was a machine like that would work out all the muscles in our body, that you can sit for 30 minutes and read a magazine and get like perfectly toned and strong.
Guess what else is happening down at the pelvic floor? Maybe not a subject that everyone wants to talk about, but there is some evidence to suggest that the pelvic floor strengthening can also help the nerves and the combination effect of the muscles and the nerves down in the pelvic floor to help with some sexual function.
We're talking sexual health.
Yes.
Which is an issue and also a very important one. Again, nothing to be shy or nervous about. It's something that's important to everybody.
And there's some studies out there in both men and women.
Yes, exactly. And we know that when muscles are toned, when muscles are healthy, better blood flow to the region, better blood flow to the pelvis, that everything just works better. So your sexual health is certainly improved. And we've actually had a lot of great patients that have had really great feedback. And we find that it has in many ways put their life moving in a positive direction. You know, one of the questions, does it help with orgasm?
Well, there's only one way to find out.
Give it a try. I mean, really, we do find that I think it does help. I think, again, when everything is healthier, muscles are stronger, really everything should be better and functioning in a better way.
Well, that's a whole other probably video, the big O, and that mysterious kind of search for, you know, what happens in your 20s versus your 50s versus your 80s. And, you know, it's a life journey. Okay, so bladder leaks, urge incontinency, sexual function,
all of it. Don't be shy.
Lots of questions out there.
This is a common problem, affects a lot of people. We'd love to help. If you want, please drop questions in the comments below. We're here to answer them. Come on in. If you're in our area, we'd love to help you.
Try the chair out.
Try the chair.
It's easy to try out and feel it and see what is that? What is this electromagnetic chair sensation?
And it can really be life-changing. So we encourage you, take control, ask the questions, come on in.
Yeah. Thanks for watching, everybody.